Oh, we're on? All right. Hello, everyone. Thank you for coming to the session. We're going to get started here. So if you could please grab your seats. There are plenty up front for those that are entering or in the back. Feel free to locate three gentlemen I work with closely. 1, 2, 3, right back there. Well, I can't hear you all the way back there. Come up front. We can have a discussion. All right. Dissemination Beyond Academia, a panel discussion with this well-established, brilliant, and engaging group. Setting the bar high. Please deliver. All right. We have Drs. Hurley, Schuetz. Funny story for those that don't know, these two are married. And before I knew that, I found, to each other, even better, because when I told you, this is more to come. The first time I met them each, I think the same day, but separately, and talking to them about their work, I thought, oh, I've got to introduce you to Emily Hurley. And Robin goes, I'm married to Emily Hurley. And I was like, all right, well, I guess I don't have to convince you on collaboration because you probably have figured that out. Fun side note. Dr. Wendel-Hummell, Dr. Fox, and Dr. Schuetz are going to be your panelists. They are going to moderate themselves and lead the discussion. And for the Q&A, Holly Zink will be down here and moving mics around to the audience once it's time for discussion. So I will turn it over to our panel. Thank you all.
All right.
Hi, everybody. I'm Drew Fox, and me and Nick are going to moderate the panel. They are the panelists. So just briefly, I'm Drew Fox. I'm a research scientist at Children's Mercy. My background is in behavioral psychology, and I am the team science navigator for Frontiers.
And I'm Dr. Nick Schuetz. My background is in social work. I'm a clinical social worker. Started out here at Children's Mercy in the emergency department as a social worker. And then as I wrapped up my PhD, also in social work, came over and joined the research side of things and joined Dr. Hurley's team. Now we call ourselves the Qualitative and Mixed Methods Research Team. And we'll tell you a little more about that later.
And we're going to do just brief intros of our panelists. Emily is associate professor in the Children's Mercy Division of Health Sciences and Outcomes Research, which is also my division and Nick's. Her work focuses on health communication and interpersonal influence within health behavior interventions. Dr. Hurley also leads Children's Mercy's Qualitative and Mixed Methods Research Team, which Nick was just talking about, and co-leads the team science function with me, with Frontiers. And she will be sharing her work in disseminating to lay audiences. Did you want to do Robin? Okay.
All right. And Dr. Robin Schuetz is an associate professor in the Department of Pediatrics at Children's Mercy. His research interests include both public health and clinical approaches to understanding obesity. His clinical studies focus on energy balance, which is the interaction between an individual's diet, their physical activity level, and their body weight. He will be speaking from his standpoint of director of the Kansas City Healthy Lifestyles Collaborative, which works to disseminate and promote uptake of evidence-based practices to community organizations.
All right, and Carrie Wendel-Hummell is a senior social scientist, PhD, at Children's Mercy, also on the Qualitative Mixed Methods Research Team. She has over a decade of experience impacting Medicaid home and community-based services policy and practice through applied, community-engaged, and team-based research. And she will be sharing her experiences and disseminating to policymakers. And we're going to have each panelist kind of briefly introduce their work. And Emily, take it away.
Thank you so much. We'll each try to keep this brief. In all, we want this to be a discussion with you too. We're all researchers trying to figure out this puzzle of disseminating to people outside of science, outside of academia. I've been really interested in this idea of research-based theater for quite some time, particularly as a qualitative researcher. I think a lot of really good work gets, put in academic journals and doesn't quite get to the people that always might benefit or appreciate or uptake that information. And qualitative research especially is often very painful to condense it all into key findings and make it very cut and dry for scientific audiences when there's so much of intellectual and emotional findings that you get when you're interviewing people, and stories are so present and they're often not very well communicated in a manuscript form. So research-based theater has this ability to not only communicate information, but also communicate kind of like the emotional context and the human side of what you're trying to research. So during COVID, tons of research was coming out on the societal impact. There was this movement to make all research on COVID open access, if you remember, which was a great initiative. But how many people, outside of science are going and reading those articles? So a PhD student and I partnered with 5 theaters and over 30 theater artists who, at the time, were not doing too much because all the theaters were closed. So they were very eager to collaborate. It was also a different time because we got funding through the US Department of State for this, which was really cool. And we worked to systematically review all of the qualitative research coming out on the societal impact of COVID-19. We classified them into topics, and then we partnered with theater artists to write, perform, and virtually produce these monologues to communicate the main findings of this research article. So I think the best way to show you what it's about is to play a little bit of a clip, and I'm going to do that quickly. Hopefully it's still queued up. All of these are still available at covidmonologues.com. How we presented them was really, here's the monologue, but here are the citations. This is where what we're trying to communicate really came from. So this is a monologue that is reviewing some of the research coming out on COVID-19 and the experience of older Americans.
Well, let me put this thing away. I see why my grandkids stare at these screens all day. These gadgets got some kind of mind control. I guess it's because everything's virtual nowadays. You gotta stream to watch a movie, to go to school, to work. Some people dating over the computer now. Don't even have to meet up no more. What's this world coming to? Now, what was I talking about before my phone vibrated? I get so forgetful these days. Lord, I'm like the old ladies in the movies. Oh, my doctor's appointment. So anyway, a few weeks later, I call up Dr. Garcia, and I tell her that I'm loving being online, but I'm still not feeling too good. I'm feeling kind of anxious and still don't have much to be excited about. I just sit up in the house all day watching CNN until my boo, Chris Cuomo, comes on with his fine ass. Woo! I love me some Italian men. Reminds me of a boyfriend I had in college, Tony. Oh, where was I? So the doctor says that she's seeing some troubling signs, and had I thought about seeing a therapist? A therapist? And when she said that, I had to lean back. What the hell do I have to talk about with a therapist?
All right, I wish I could play more. Each of these monologues are about 10 minutes. You can still find them all, and that was our attempt to disseminate to lay audiences. We had virtual performances and surveyed audience members on their reactions to it. Now I'll turn it over to Robin, who's gonna just overview his work with community organization dissemination.
So my name is Robin Schuetz. I'm an associate professor here at Children's Mercy, and in addition to my clinical research, I lead a community-facing program funded by Children's Mercy called the Kansas City Healthy Lifestyles Collaborative. What we try to do at the KCHLC is try to align community efforts around healthy lifestyles within our region, primarily focusing on active living and healthy eating. So essentially what we try to do is, there's a lot of great organizations working in this space out in the community across a variety of different parts of society. So schools are doing great things, healthcare providers are doing great things, public health is doing great things, other, sports organizations are doing nice things. In the current system, those groups don't talk to each other for the most part, except from, kind of one-off interactions typically. So what we try to do is we try to facilitate connections between those groups that normally wouldn't be working together. So we're trying to break down silos. One of the things that we very intentionally try to do is to try to help them build the evidence base for the work that they're doing. And we do that through a variety of ways. We do some resource sharing, and we lead some initiatives like the Kansas City Physical Activity Plan. We have a CDC project where we have lots of community partners. But then another way, and it's really kind of at the center of what we do, is regular in-person meetings. So we do this every quarter of the year. We bring people together for an in-person 2 to 3 hour meeting. And we try to get all those different organizations from all these different sectors to be there in person. And we have a topic of choice to share with that group. For example, next week is our March quarterly meeting, and we've got a Children's Mercy weight management provider who's going to give an update on the current state of the science on obesity, anti-obesity medications. These medications, GLP-1 receptor agonists, you've heard all about, even if you're not involved with weight management at all, you've heard about it extensively. They're becoming a big part of our society. The data on them is rapidly changing as well. And so we are using next week's event to have an expert come and communicate the current state of the science to these other organizations. And so what we try to do, and you can see on the screen here, is we really focus on engaging with community organizations as opposed to individuals. So you often hear about grassroots organization. We consider ourselves, we try to focus on grass tops organizations, with those community organizations being the grass tops. And then we rely on those community organizations to then disseminate that information further to their individuals that they are interacting with on a daily basis. So that's a little bit of what we do, and I'm happy to talk more about it throughout this session.
Hello, and I am Carrie, and I am the newest social scientist in QMRT, still figuring out our new acronym. And I joined from the KU School of Social Welfare, so that is a lot of the research I'm going to be sharing today, or my dissemination work that came out of there. So as Nick had shared, I am an expert in the Medicaid-funded home and community-based service system. Simply put, layman's term, that's our Medicaid-funded home care system for older adults and individuals with disabilities. The intention is to provide home-based services so that you do not have to go to nursing homes or institutions. So since it is Medicaid-funded, right, it is state policymakers are really important to that work and what we are trying to do. My projects have included developing more reliable and valid assessment instruments to ensure that we are determining eligibility more fairly. In more recent years, I looked at the HCBS system response to COVID-19. And most recently, and what the project shown on the screen is from, is our direct support worker training and career ladder projects, which included a labor market analysis. Direct support workers being your home care aides and the frontline staff who are delivering these services in the community. Actually the largest workforce in the US, but very invisible. And very visible to our policymakers. This was actually a state-funded project with the Kansas Department for Aging and Disability Services, so that kind of gives me, of course, a direct conduit to them and the reports we prepared for them. But beyond that, we recognized that it was just really important to make sure that our policymakers knew what we were working on and what we are finding in our analysis, because they hold the purse strings. They fund the budgets. They set the reimbursement rates that drive the wages. So we conducted this really extensive labor market analysis. I think our report to the state was, one of my GR raises here, I mean, we could fairly say 100 pages when we put it all together, right? But how do we whittle that down to something our policymakers are gonna look at, right? So we were with our community partners and with some communication specialists and across our team to identify what do we think are the most important points that we can put on a one-page front and back handout. So I don't know if you can see all this, that's okay. The point is that we had to turn a 100-page report into a 2-page infograph, and this is how we did it, so that our policymakers will look at it. This is the largest I've ever seen our infograph. Which is really hard to do as a researcher because I want to tell the whole story, all 100 pages of it. So how do we get it down to these key facts? We leaned a lot on our community partners to say this is what is important. Individuals who have more advocacy experience, who worked closer with the policymakers, this is what they need to see. A communication specialist in graphic design, although ultimately we did this on Canva, so this is really accessible. Or Canvas, sorry, I always mix those systems up. So this is really easy for any researcher to do. Yeah, as I said, just recognizing the importance that we did have to find ways to get this information out in a really digestible form that we thought our state policymakers would hopefully spend 5 minutes in between meetings and between sessions to take a look at this and to be educated about one of our largest workforces in our country, because again, they set their wages.
Awesome, thank you to our 3 panelists. Really cool examples, and I'm assuming a lot of people out there like me are thinking of other ideas of ways that we might be able to disseminate our research findings to the community. But as we think about some potential ideas, of course, a lot of times it comes down to funding. So is funding something that we should be thinking about? And are there funding mechanisms that will pay for some of this community dissemination?
I love that that's the first question. Should I start?
Go ahead.
Yes, you should think about it right away and put it into your grant applications, because they want you to have a dissemination plan so you can really justify this and find out who the resources are, who you can like contract with or give a little bit of FTE to from your communications department maybe. You might even be able to bring on students to work on videography who come from communications, who might you contract out with for website development. I was really fortunate in my last project. There was a deliverable that really demanded that we had a communication specialist, because there was another part of the project where we had to kind of sell this career and recruit workers. So we knew we needed a communication specialist who had videography, photography, and graphic design skills, and who could create and manage some social media sites. And then once we had them, I realized, oh, there's a lot of other stuff I could have them do related to dissemination, and then really leaning on their expertise. And it worked out so well that moving forward, I'm always going to think about, what do I need to put in the funding application to get some, whether it's a videography or graphic designs or social media specialist, buy out some of their time so that they can take this on. Because it's time intensive. You can't do it yourself as the PI.
And then maybe a quick follow-up question too. Is there a cost that might surprise people to learn about when you've run into some of the cost of community dissemination?
I think some of it's surprising on how little it does cost. You know, like you can do a meaningful infographic and a community-based dissemination. Even our research-based theater project, like you would be surprised to know that this was all pulled off with a $10,000 grant. But like the bigger, I think, consideration is like our time, right? The more time you put in, the better it's going to be. And I really love that PCORI now has a specific funding call for dissemination. You know, they have recognized this is like a whole project in of itself to do well. NIH, you can write it in. You're supposed to write it in. I feel like there's not a ton of accountability. And so sometimes it gets kind of brushed under the rug when people are focusing on their publications and the things that, you know, in our system reward researchers. So there is a cost. Like, so, you know, doing this well, you want to budget and have funding. But I think, you know, you can do a low-cost dissemination outside of academia if you have that time and the support and the commitment from people around you to do it.
And I guess that's the thing that I would add is it is pretty, you'd be surprised at how cheap it can be to do some of this work. But then there's also lots of existing resources that are available for people that they may not know about. So for example, my group, we are always happy to have any researcher come and present to our group. We're always looking for people to disseminate their work through our channels, and that costs you nothing except your time. As I've started in my grant applications now for my clinical research, I now build in dissemination through some free Children's Mercy resources, like the Parentish blog that Children's Mercy puts out. And so I think most of our institutions take the time to invest in some dissemination techniques. So you can really take advantage of a lot of those services for free as part of your work.
All right, let me add what ultimately ends up being sort of a follow-up to this, which my original question was, at what point in the research process should a team start thinking about dissemination? But we've sort of addressed that already in that, you know, you have to put a dissemination plan in your grant. But so let me rephrase it a little bit, which is, if you're getting to the point in writing your grant and now you've already designed your research and now you're like, oh, well, I have to put together this dissemination plan. Somebody alluded to it sort of being an afterthought, or there not being accountability. So that means, to me, the question is, at what point in thinking about your research should you be thinking about the dissemination plan itself? Like, once you've designed your study and now you're writing a dissemination plan, is that too late? Is there a good argument to be made for thinking about it sooner?
I think at any point, it's worth thinking about. Early is good. If you've published a paper and you realize there's somebody that needs to hear this in a different way, it's not too late. The project I was talking about, this was none of the research that we ourselves produced. We systematically sourced it, and then we reached out to the scientists to see if they wanted, you know, it to be part of this project. And they were like, oh my gosh, yes, because we haven't done enough communication of this, and we might not, you know, really know where to start. So I think the whole field of dissemination is sometimes feels like, you know, the little sister of implementation. We're all talking about implementation science, but like, as we elevate dissemination as a pursuit in itself, I think these efforts, you know, can be picked up at any time we feel like there needs to be more communication around research that has gone on. I'm not sure all the funding mechanisms always line up with that, but I would say, you know, plan early, but it's never too late.
Agreed, and community engagement is so important for this, and you want to engage your community partners right away, and be clear that that's like one of your asks of them, that you're going to need them to help you with dissemination, to identify the main points, to help identify who we're sharing the information with, and how. And then as your findings start to come in, right, you get your preliminary findings and stuff is really interesting. Like right then you think about, okay, who am I going to share this with? I think our instinct is to think about, oh, where am I going to publish this? What's going to be a good journal? But also have, you know, try to develop the instinct that you also think about what community partners, what policymakers need to hear this. Who am I going to share it with and how? And then, you know, I'm always working on fairly large teams with very large networks, so you kind of need to identify who has what talents that are going to help you with this.
And it can also be very context specific. So I think a lot of the examples that we've talked about today are, kind of public health related or community health related, and you can easily see how you want to communicate those findings out to the public. But even in some of my clinical research, I've been asked, how is this very academic finding going to implement clinical care? And so in that context, you have to really think about how you're going to disseminate out to clinicians, which is going to be different strategies than if you're communicating to the lay public. So even if you talk to like a bench scientist up on one of the floors above us, even though they may never communicate their finding on organoids to the public, they do need to communicate those findings to other important stakeholders. So, you always have to be thinking about it and including it in your grant applications, and it can be tailored to that unique audience.
All really good points, thanks. Okay, so this is kind of a common phrase, but a little bit of data is a dangerous thing. So thinking about that, how do you balance being comprehensive? Somebody earlier in this session on the panel said that you want to tell them everything, you want to tell them the whole story. So how do you balance that being comprehensive with also being digestible and also interesting to a lay audience?
That's the hardest part. And that's why you need your communication specialist who specialize in this, and your community partners, so that they can pull out what is most important. And it's really hard to let that go as a researcher, some of that control, because you want to keep adding nuances and details, and you have to be a little comfortable with letting that go. You have to be a little comfortable with maybe people misconstruing your findings. And I guess what I've told myself and reminded myself is, even when they see the full Jenner articles, people are going to misconstrue your findings. So let's just have a little faith in your community partners and your communications experts and what those main points are. And then think about the strategy in conjunction with open access, so that you can provide QR codes and links to the full thing, or if you have the resources, a website that has all the other detail you wanted to share.
And I would just add, or reiterate that, sharing your information with someone who knows nothing about it, whether it's a communication specialist or even like a relative, your mother or your uncle or something like that. If they can't understand what you're explaining, you're probably including too much information. Or if you're excluding some key background information, they're going to let you know right away. They're like, well, why does that matter? So they are the best audience to initially run your ideas by and help you identify, oh, here's what's important, and here's what you're currently leaving out of how you're currently communicating what you're talking about.
Yeah, no, those are good points. And I think it also kind of speaks to dissemination as a science, right? I think a lot of us can achieve a lot of this outside of formally studying it, but if you do have the opportunity to formally study and actually collect data on, okay, is this message resonating with people in the way I want to, or should I be doing it that way? And I think the more we engage in dissemination science, the more we can think about these questions about how much data and how to include it in a thoughtful way, just in practice too. We struggled with this a lot with the COVID Monologues project, and what we ended up doing was we gave the playwrights a research packet. So we distilled down the key points of the articles and a couple that we were like, we want this monologue to communicate these things. The rest of it is kind of there if you want it, but we had to give them artistic license, right? So, what is research and what is art in these? Just watching it, you wouldn't really know. But there is somewhat of both in there. And the challenging part, I think, was just, then seeing what is going to speak to people. And we did study that. So we surveyed all of our audience members, and we tried to, throughout the 8 monologues, have a very diverse representation of characters. And one of the things we were going for is, people relating to the stories of the character and getting some new understanding. And we didn't have anybody that represented the Latino community, but people that identified as Hispanic in the surveys, like their responses looked differently because there wasn't a character in there they could identify with. So if we do this next time, you know, we know where those gaps are and who we're missing, who we want to make sure we communicate to in what ways. So I think, you know, any opportunity you have to like study this and collect the data on it or learn from other people that have just informs how you make those decisions about what to put forward in the messaging.
And just a real quick follow-up. A few of you kind of touched on this, but I do try to, well, I don't try, but I end up having very passionate discussions about science with my friends, sometimes heated, but that's for another time. And they always say something like, well, where's the evidence? So I throw them a bibliography full of citations, and they're like, I can't open any of these. Which is a fair point. So when you're kind of disseminating to audiences that may not have access, do you even bother with citations? Because the researcher in me feels like I need to put a citation to show that it's legit, but if they can't open it and read the article, I don't. How do you resolve that tension?
My decisions about citations are actually in regard to whether I can fit them in the 2 pages or not. And then if possible, provide a link to a website or somewhere that has more citations. But I do think open access is the answer here. And I know that's expensive, but that's also part of your dissemination plan. And talk to your librarian because you might be surprised by the open access resources that your institution has that you have no idea about till you talk to them. I had no idea that so many publishers let you create a preprint copy and then you can put that on the repository for your institution. And now you have a direct link, and it's not the fancy version in the journal, but it's all the same content. And it takes a little effort. All I had to do was give it to the librarian, and they did everything. Right? And so now I do have a QR code, and then I have made my publishing decisions and recently based on which journals our library has agreements with.
Yeah, it's tricky, right? Because it's one thing to do it for work that we publish. There are a lot of great resources that our institutions provide. Most of our institutions have open access agreements with several journals. I had that scenario with a grant or with a paper I just published that because of my affiliations, I could get a free open access. You can also have most institutions can keep a repository of your own papers that you can put on a publicly available website. So you can get around that with your stuff. The problem is, you know, if I'm citing someone else's research that is not open access, where I can't make that open access, then, you know, what can you do? And, you know, there's not much you can do that I know of about that. The bigger picture, though, I guess, is sometimes it depends on the context of whether you need to provide, you know, 10 different references or not. With your buddies, I love that they want to see and read academic research articles. Most of the people that we interact with have no interest in doing that, so you can highlight the key citations on your two-pager and then, you know, just leave it at that.
Great points, thanks.
Okay, I'm gonna turn us to a slightly different topic, and that is, you're all team scientists by nature, and you work on all different kinds of teams, and not every member of a research team that you're on is necessarily going to be well versed in dissemination and implementation or that familiar with it. So what is your pitch to a fellow research team member who isn't necessarily wanting to spend the time and effort on community dissemination?
I mean, I think we need to build it into our own kind of standards of success as much as we're able to control. Like our team has talked about, we need to include this in our annual report, like dissemination that we have done outside of academia. And I don't know. I feel like whatever research you're producing does have a message, and who needs to hear that message will just vary from people to people. And there are some scientific teams that maybe this doesn't need to be on the nightly news. It has to go to a specific group of clinicians that use this one tool, that they're the ones that are the audience. I don't think I've ever been in a situation where we haven't had those conversations in team science, like who is this research for, right? And if it's for people that might not be accessing the findings in the ways that are set up for us to kind of naturally put them out in academia, then I think it's not a hard sell to get people on the same page of like, we have to get the message out some other way. Now, how much time and effort do we put into that outside of everything else we have to do? That's where I think the structures and the just norms in our academic community could rally around that in a better way.
Those are great points. It's also not hard to think of examples where dissemination, when done poorly, has caused projects to fail. If anyone was at my presentation just an hour ago, I talked about an initiative that we had operating within Children's Mercy clinics for 7 years or so, 7 or 8 years. And I think we did a lot of things right in that project. One of the things we did not do right was disseminate back to the clinic of the ongoing value of that initiative. And at some point, the providers decided they didn't want to participate anymore. So this project, which we spent a decade working on, all of a sudden was essentially ended. And in part, that was because of us not appropriately disseminating, or what we were disseminating wasn't in a way that they found useful. And so there are ways that your hard work can stop because of poor dissemination.
We just submitted a second paper for COVID monologues that's interviewing all the scientists and the artists involved. And it was just very interesting. Like, the scientists, for the most part, were very excited about this. They thought this was, I'm glad that we're outsourcing the dissemination because I'm not an artist. I couldn't put something out like that. And now my work is reaching people. And that was a great kind of team science thing. We're bringing people together with different skills. But there was one person we interviewed that had such an interesting take. And I don't really know how I feel about it. But he was basically like, it's not really my job to disseminate. Like, if I do good work and I put it out in the world, it'll get picked up. Like, somebody, if it's worth noticing, somebody will notice, and then it's kind of their job to carry it to who needs to hear it. And I think that's not entirely false. Like, if good research is coming into the headlines of really top journals and gets a lot of natural attention, there is a natural aspect of dissemination, if I'm speaking right. Like, you're doing good work, people will talk about it. But the active part of dissemination, like, is it your responsibility as a research team to get this message out in a different way? I really do think it is, because there's so much research that goes on, and it's all, has messages that might not always be appreciated outside of your research team. So I'm not trying to make a point with that, but just sharing like an alternative view of, it's not a widespread kind of embrace that this is an active responsibility of scientists, even though everybody up here thinks it is.
No, I mean, I want to comment on that real quick, just because there's countless stories in science where, like, we like to think of the data itself as like existing in some kind of like meritocracy, like the good data will rise to the top, and it literally does not work that way.
Yeah.
I don't think, and because there's countless examples of huge breakthroughs, but then you can find someone else had figured that out 10 years ago, but just nobody knew. I think penicillin is an example of that. Like, there was research showing the exact thing that Alexander Fleming had discovered from 10 or 15 years before that, but it was buried just in some, obscure book somewhere.
Should have done open access.
Yeah, they needed open access back then. But that's just one, but there's many examples like that, so, yeah. Somebody else wanted to chime in.
I was just going to quickly say, I've been so fortunate to be on teams that do really value this. But when I think of the example that Emily shared, which is striking. I just can't help but think, why would we do research if it doesn't have the potential for impact? And how is it going to impact anything if we don't disseminate it strategically and thoughtfully?
Okay, so we want to make sure there's plenty of time for audience questions because we want this to be interactive. But if we can maybe combine, just because Drew's last question is really important, so maybe the three panelists can choose between either my question or Drew's question. My question being just what are the barriers and challenges you've seen from either the community side or the blank, the institution, the academia, the other side, or...
Yeah, the other question we were going to ask is what can institutions or what should institutions do to support these efforts, community dissemination?
I talked a little bit about that, so I'll just briefly about challenges. At least for the research-based theater, I think it's the getting the right people in the audience and the not just preaching to the choir. Some of the most inspiring examples I've seen really go to targeted areas like, a law school, and they're speaking in front of students who are studying this topic and are really, they're the people that need to hear it, and we've made sure that the right people are in the audience. I'm not sure, how a work like this, who chooses to come and who doesn't choose to come is a consideration. And so I think the challenge is just reaching the people that you want to reach in the first place.
I guess I'll maybe tackle the institution. There's the Frontiers institutions. I don't know all of what they're doing, but many of them I have seen that they are doing great things around dissemination. Whether I already mentioned the Children's Mercy Parentish blog, that's a great way for us to communicate with patients and their families. Like I mentioned, Children's Mercy invests in my team, and we are happy to help disseminate. I know during COVID, there was great dissemination by KU Med Center with their morning COVID updates that they would post, and that would widely be picked up by local media. So those are really great things. My recommendations for what they can do better is, of course, we always have to be constantly evolving and thinking about what we're doing. And it's even more so true with things like AI. If anyone was at the great session this morning after the keynote that was in this auditorium, it was all about AI. And there were multiple examples of AI-generated podcasts that discussed a health finding, AI-generated images to help disseminate or communicate a specific topic, and even an AI-generated video in a completely separate language from when it originated. And these things this is coming. And they can be used in a lot of different ways. And I think that we need to be thinking about the good ways that they can be used in helping to disseminate our work. And I am a physical activity researcher. I'm probably not going to be able to figure out how AI can help me disseminate things, but my institution can, Frontiers can. So that would be my recommendation.
I think institutions could be doing a lot more to allow us to outsource and delegate more of this, or maybe better publicizing what they do have available. I really wish that there was, and sometimes there is somebody that can do this, and sometimes I can't find that person. I wish there's just somebody I could give my article to and say, make this a research brief, or give them the content and say, do this for me. Because even though Canvas is easy, it's going to take me a few hours, and I just don't have that right now. I have no videography skills, so I wish there was somebody I could turn to and just say, I need a 1-minute reel us that will work well on social media. And the thing is, I know all of our institutions have all this stuff. They have communications teams, they have public relations teams, they are doing videos all the time to recruit patients and to recruit students. And I feel like we maybe aren't just fully using those resources to also put our research out there in very public venues and in ways that are very tailored to the different audiences. But then there's also another real challenge here is like ownership issues. So when I did have somebody at the school that I was able to just give my journals to and say create a research brief, it was a really gray area in regards to whether this was self-plagiarism, which is just ridiculous to me. But that we really had to kind of tailor the brief in more ways than we should have had to around ensuring that we weren't violating the copyright with the journal who first published this. Or if I'm doing a research brief before I publish it, am I going to make it not publishable now because I already put it out there for free? And I don't even know why this should be part of the consideration, but it very much is.
Okay, awesome. Thank you all so much. But before we get to questions, I think we wanted to run through
Thanks.
examples.
So again, you heard our bios. None of us have dissemination expert in our bio. We're all researchers that care enough to try our best and do this, but researchers like you struggling with this and want to talk about your experiences too. We also just are fans of things that we come across in our world and wanted to share, outside of the examples we shared, some of the things that we really appreciate in dissemination outside of academia. You probably have many examples from your own lives and communities and work. Some of you might know Science to Art, from BioNexus. Nick was bringing that up. Carrie told me about Frontiers for Young Minds. It's a kids open access journal edited by kids, which I thought was really cool. Robin put up the Parentish blog that you've heard about, podcasts, Science on Tap. Science Politics is a great publication that Dr. Lauren Yan just published in, and putting evidence in a policy forward language. New America is another type of publication like that. I put up a blurb from a conference that I'm going to later this year that just really tries to bring communities into that academic conference too and make that space for them. People on social media, video abstracts. If anybody knows April McNeil Johnson and her publication in Pediatrics, there's a video abstract along with that. So these are just some of our favorites. You probably have your own, and we want to hear from you now.
Good afternoon. A wonderful presentation. So, taking everything into consideration, if we go back to our institutes and encourage all of our faculty to disseminate their research findings, are you worried about dissemination overload? I can tell you, if providing our research findings to physicians that may be interested, they're probably already overloaded with a lot of information. So first of all, how would you resolve that situation? I know it's a hopeful situation, but how would you resolve it? And second, with respect to getting help with dissemination, I do think the Institute has a big responsibility in promoting, monthly sort of updates on the biggest things that have happened in the Institute with respect to findings this month. But of course, if you want to make your own videos, have you thought about integrating students, students from different departments, students from theater, students from computer science and engineering? That wonderful talk this morning by Dr. Ola Soke, I think, Ola Soke, seems to be relatively good AI sites that she said within 48 hours with her expertise can generate these videos. So that was my sort of 2 comments / questions.
So was your first question about being the faculty feeling overloaded or the public being overloaded with information?
What would happen if everybody decided to disseminate all their findings all the time? Dissemination overload, how would you?
Yeah.
You're going to have to stratify sometimes.
Yeah.
Don't disseminate everything to everyone. be strategic. Who really needs to hear this message? Is it every physician at this facility, or is it those in certain divisions? Is it, right? I don't send all my briefs to every state legislature. I send them to those on the committees that matter, that have the power. And then, even if you are sending something over a listserv, if there's a specific audience you really want to have it sent to, the PI needs to be forwarding that or sending that directly as the PI, so that it's actually noticed and opened and read, or if there's another connection or network, again, your community partners. So have it sent by somebody that matters to that person, and send it to people to whom it most matters.
Yeah, it's a great question. And I think it goes to what Carrie was talking about before, like just being really strategic about what is put forth, because, you can only be loud so much. I think we're already in an information overload society, so like, why not get in the game and put our stuff out, but like being strategic about what you're loud about and what goes in the background. The project I shared, these monologues were based on about 100 research articles. Nobody's ever going to appreciate every finding that was in those articles. Some of it is inevitably lost, but like, could we find the main things that like we wanted to spend our kind of attention currency on, if you will, and like prioritize that and put that forward. And we are doing this with students later this year. I'm really excited working with some students to develop local Kansas City-based, research-based theater later this year. So there's more to come, at least in my area.
We do have another question here.
Thank you so much. So my question really is touching on two issues, which is the community engagement comes dissemination, as well as the challenges and barriers. Because oftentimes in research, what I've heard is that, particularly from community, there's a lot of mistrust when it comes to academia spaces, when it comes to medical spaces, et cetera. They feel like, this researcher came in, they did work with us, they went away, they published everything, we got nothing in return. So now when we're going in doing the research, they're like, okay, cool, but we're not going to engage, we're not going to participate. So I would love to hear from you all of how you all are working within community to really, one, change their views when it comes to research and medical, and really feeling that you're not doing them harm, and two, to therefore now help you with dissemination.
So we do actually, in our division, we do have another team called the Community Engaged Research Team, and they are experts and amazing about community engagement and all the different ways to involve the community in your research in a meaningful way. And so I think, if you plan it out well, the community should be involved from the get-go in your project, and they should be able to guide you in how best to disseminate the findings that they want to know in the best way to that community. But it's a super good point, and the community, we can't just be sitting up here in an ivory tower telling people like, you're welcome we're finally sharing with you all this amazing stuff, and they're like, we don't care. So we need to make sure that it is relevant to them, and that that they're part of it from really early on.
I thank you for bringing that up, because it's a huge challenge, and like, I kind of think dissemination is where we're dropping the ball the most, and having interactive and dissemination that helps to just like build that trust and know we didn't just use you to publish our paper. And I don't think anybody's doing this perfectly. And I think we all, we all know that the value in building that trust can't be understated. One thing we tried to do in our work, which I modeled after this pioneer research-based theater who did these plays on the pipeline from schools to prison. She had community discussions after it about what are the solutions in our community. And we did that too. I didn't really share it in the beginning, but in these virtual performances, we had different audiences. We went to high schools for the virtual performances. We had general audiences. We had more like public health practitioner audiences, and then afterwards we had a facilitated discussion about, okay, what is coming out of here, and what is of value to you, and they really took it from there. So I think like looking at dissemination as an interactive event too, and making sure that they're a part of that is super important. But I'm so glad you brought it up because it's something I think we all just really need to do better at.
And then just the only thing that I would add to that is I think it is a responsibility of funders as well to think about this as well. And Frontiers does a great job of this. When I applied for a pilot award, part of the application process was to visit with their community advisory board. And that step in the process, before funds were awarded, it really was enlightening to receive that feedback and that interpretation and their comments. And it did change ultimately what we ended up applying for in the application. So I think that funders should do more things like that to really build it into the entire mechanism.
It is a challenge. I was just going to say it is a challenge that your community partners can also be a resource if you're really partnering with them and going to them as you are finding your findings and getting the feedback from them. So they're the first to see your findings. And then they can tell you what stands out and then what should be shared with others and who we should be sharing it with. So when you make it a true partnership, yeah, it takes more work on the front end, but then at the back end, they're now a great resource.
All right, we have one last question in our last 4 minutes.
Okay, so I guess maybe changing gears a little bit. When thinking about dissemination, one of the biggest changes that I've seen has really been like kind of the death of academic Twitter as a way to communicate and disseminate, really to other academics, but also to people working in policy spaces and engaged members of the public. And that was a lot easier, right? Like, so for like, I think probably like 5 or 6 years there, it was like my main way of dissemination, had a decent following, met great people that I'm now collaborators with. And so I'm kind of curious for you all, what are you seeing as any kind of stand-in for that? Because, you know, the bummer about dissemination is that if you just send it out there and you don't get anything back, that's fun, you screamed into the black hole. But so I guess I'm kind of curious, because Blue Sky isn't it, Instagram isn't it, TikTok isn't it, there isn't been no replacement. So I'm kind of curious what people are doing for that more day-to-day dissemination stuff across your fields.
That's such a good question. And I actually, I want to open it up to anybody else that has ideas because I want to learn the answer as well. It's such a good question. And I feel like something really happened when Twitter went down with a really big outlet that scientists had.
Yeah, same. And just my current thinking on this is not so much as what's the next Twitter, is what existed before Twitter. And maybe there was nothing that we had, and maybe that was just like a brief period where we did have a good dissemination period, and it's going to be a while before there's another social media tool that replaces it as a good dissemination tool for academics. And so maybe there's nothing now, and we're waiting for it to be built, but certainly open to what others might think.
And real quick,
LinkedIn, maybe?
Substack.
I mean, yeah.
Next door, I don't know.
Instagram, yeah. I mean, that's the next best thing I've seen with.
Well, and that's why I intentionally put up some of the influencers that I follow on things like Instagram, like Emily Oster. Some of you know her. If you're a parent, you probably know of her. She's an academic who kind of reimagined herself as a social media influencer, and there's a few others that are like that, where they actually take science and take academic papers and communicate it out to the lay public. That's great for them. Now, that doesn't mean that if we send her our articles, she's going to talk about them, but there are some examples of people that can make it work.
And I mean, it's something that I think is worth us paying attention to, because I do worry that the future just looks more siloed. You know, like there might not be something that is universally inviting to everybody you want to reach, and you know what's going on outside of the platform that you're using and what's going on the other platform someone else is using. I think that's worth paying attention to, because who knows if there'll be a replacement, or if we'll just get a little bit more fragmented.
And I know we're at time, but briefly, just wanted to give a plug for our two teams. Again, I'm from the Qualitative and Mixed Methods Research Team, formerly known as Formative Research Team. So here are some of our resources. That top QR code you can scan to schedule a consultation with us, and we can, you know, anything from brainstorming an idea about potential research all the way up until analysis and dissemination ideas. And then Drew.
Yeah, like I said, I'm from Frontiers Team Science, and the easiest step if you have any team science questions is to just email me, dtfox@cmh.edu. You can also find us on the Frontiers website for anything regarding, you know, team science questions, help, consultations. The big service that we offer is collaboration planning, where we help your research team address common areas of team conflict and things like that. And it's a 90-minute session that I run with your team. And there's a QR code to the intake form of that. And of course, you can find out more about that on the Frontiers website as well. Thank you all.
Awesome. Thank you all.
All right, big thank you to our panel. All right, we do have a 15-minute transition, and the next session starts at 2:15.